Okay guys, so now let's start to have a look on the legs muscles. And when it comes to leg muscles, when we are studying, we can think on it by separating in the upper leg and the lower leg. And first, for the upper leg, we can separate them in four great group of muscles. And let me get a reference to show you. Yeah, I've got one here, but actually it's kind of the same of this one that we get on the Anatomy for Sculptors book. And yeah, let me show it here so we can better understand the groups that I'm talking. The first, on the upper limb, I mean, I would separate, the first group would be this one that is called the quadriceps. And the quadriceps are actually formed by four muscles: the vastus lateralis, vastus medialis, vastus intermedius, which comes hidden behind those three here, and the rectus femoris. So this one will be the rectus femoris. This one on the lateral will be obviously the vastus lateralis, and this one, another one here, will be the vastus medialis, because it stays close to the medial border, which is the center, the half of the body. And yeah, as I said, they are formed by four muscles, but on the surface we are only visible. They are only visible those three: the rectus femoris, vastus lateralis, and vastus medialis. And all of them, they reminds a lot the triceps, because they're gonna have a big region of tendons over here, and also we're gonna have all those tendons will connect into the patella, which is a bone that we have seen in the last lesson, and then the patellar ligament, which will connect over the tibia. And yeah, this first one will be the group that I said, the quadriceps. We are also able to see the vastus lateralis from the lateral view, and all of this here will be the quadriceps. And then we can have the glutes. And for the glutes, let me do it in another color. I don't know, maybe red. So here we're gonna have the glutes muscles, and we can see that we have here on the iliac, the posterior iliac crest, this region of the pelvis. We're gonna have the origin for the gluteus maximus, which is this one, which we insert over here in the greater trochanter, and also on the fascia latae, the iliotibial, I forgot the name, iliotibial tract, this region over here. Okay, so yeah, we're gonna take a look on everything, but this one will be the gluteus medius, which also connects here into the greater trochanter, and then we're gonna have the group for gluteus muscles. And now in blue, I'm gonna make the hamstrings muscles that are responsible for tilting the lower leg like this. And we're gonna have the biceps femoris, the semitendinosus and semimembranosus. Let me get that. Where are them? Yeah, right over here. We're gonna have the biceps femoris, semitendinosus, and semimembranosus. All of them making those hamstrings tendons. And also in the middle, we're gonna have the adductors. The adductors are all of this group here that comes over the middle, right after the sartorius muscle. So sartorius muscle will be this one which starts on anterior superior iliac spine, that we are used to call the ASIS, right? And is the longest muscle that we have in the body, and it starts from the ASIS, and it it inserts on the knee, right over here. I don't remember where exactly, to be fair. Oh wait, it's saving. And but we're gonna have a look on it. And yeah, right over here, pes anserine, I'm not sure. Yeah, it's a region on the tibia bone, close to the head of tibia, right? So this is the longest muscle that we have in our body. And yeah, it was just missing the sartorius, yeah, and the tensor fasciae latae, which will be just a muscle like close to the gluteus medius. It also starts on the ASIS, and it goes to handle the iliotibial tract, which is this fascia that goes over the head of tibia as well. Okay, so we have several muscles here in the legs, as we can have this look, but don't think too much about each muscle. Think first on those great groups that we said. So I have the quadriceps, just to review. Quadriceps, we have the adductors, and we have the glutes and the hamstrings, right? So besides those, let me see, 1, 2, 3, 4 great groups. We're just gonna miss the sartorius muscle and the tensor fasciae latae, 2 muscles that will start from the ASIS, and we will also make a nice gesture line that we have here, just under the ASIS. We're gonna have kind of a V, inverted V shape going to the ASIS region. So yes, let's take a look on everything and build then on our écorché. So here I can leave my full screen method, and just one thing that I was realizing here is that our femur could have maybe a thinner region on this part. I'm not sure if this is actually duplicated. If I hide it, what is this? What? I have a duplicated folder, so I will delete this one. Good. Yeah. Oh no, what happened? Oh yeah. Okay, good. So let me first do a pinch. Yeah, I think let me correct here. With move brush and back face masking, turn it on. Yeah, just to make something closer to what I'm gonna have there. But yeah, that's it. So let's start by the rectus femoris muscle, and to do this we can go right over here and maybe insert some primitive, I guess. Inserting a cube, then Another subtool, I can make this really a cube. Make it thinner. Turn it on, the local symmetry. And then I can make something like this. That it will be easier for positioning, you know. So we know that the rectus femoris is going to start to the anterior inferior iliac spine. So it's not the axis, but it's this region over here. So we can make kind of this shape. And then we can start to smooth, to subdivide this. And it goes right over the patella, so and then I can give it thickness with the move brush, with back face masking, turn it on. Right. So this is will be our rectus femoris muscle, and then let's go for the vastus medialis. The vastus medialis will be kind of the same, but we will start right over the side, more on anterior part, not anterior, medial part. And it goes insert right over the femur. So you can position it and inflate a little bit more this final part. Let me hide this first. And now with this one. Okay, and now let's make the vastus lateralis. So duplicate this one and do the same, but first a new origin. Let's position it right over here. Okay, but this one, as you can see, it has more volume over the sides view, like this, and it will connect over this region into the femur, right? Okay, after we're gonna have to rebuild everything, I think. Not rebuild, but review all of the muscles volume, because now we have just kind of just origin and insertion info. After, when we have all the other muscles, it's gonna make more sense. Good. And so then let's start to make the, I think the sartorius would be nice, because we can already put on it. So let's duplicate this. And I will use a move brush, so I can position it right over the region and the tibia, and then make its rotation over. And good. And how did I said, it goes and starts on the axis, right here, anterior superior iliac spine, and it goes right over, actually behind the vastus lateralis, and then it connects right over the tibia. I'm gonna just move the muscle like this, and then I can make it very thin. Oh no, go back. Let's first do something. Let's do a zero mesher and disable our Dynamesh, maybe with less polygon count. Good, like this is perfect. And then we can smooth it a bit, paint it in red, and then we can make the gesture, the proper gesture. Yeah, good, perfect. We can give it a little bit more thickness on this view. Something more like this. And good, so now let's make the glutes muscles. For the glutes, I think it would be nice to have, let me see. Yeah, let's do the glutes muscles over the next lecture.